Assalamu alaikum. This is Dr. Tasneem. Can I have a seat?
Sure.
Thank you.
So, Dr. Tasneem, you had your scenario outside. It's a 24-year-old young man who's come into your emergency department. He's now in one of the rooms waiting for you. He's got a wound on his right lower leg. What would you like to do?
Okay. Was the patient triaged or not yet?
He was triaged, yes.
Perfect. Can I get a set of vitals?
So the nurse has given you vital signs as follows. Temperature of 37.1 degrees Celsius. He's got a heart rate of 89. He's got a blood pressure of 121/87. He's got a respiratory rate of 14. Is there any other information you'd like?
If we get an SpO2 as well?
Sure. It's got SpO2 of 100% on room air.
Perfect. Now I'm going to the room to proceed with taking history and examining my patient. What do I see walking into the patient?
You see a young man. He's sitting comfortably. He's in a little bit of discomfort. He's holding his right leg, of course. Not in severe pain. He's talking to you normally, and primary survey is intact.
Okay. I'm going to proceed with taking history and introducing myself to the patient. So this is Dr. Tasneem. I'll be taking care of you today. Can you please let me know what happened today?
Sure. Hi, Dr. Tasneem. So I'm not sure exactly how this happened. I was walking to work. I had a meeting. I have a meeting later this afternoon. And I guess I shouldn't have taken down this alley, but I went down the street and there was a trash can. And out of nowhere, there was a cat that just came in and attacked my leg. It was scratching at me and it bit me and it wouldn't let go. I really had to kick it to get away and I had to run away. And eventually I saw that there was a little bit of a wound that was quite bloody and nasty. So I cleaned it the best I could. I changed my pants. But having looked at it, I decided I'd just come here and get it cleaned properly. So yeah, I'm here.
Okay, let me just ask you a few more details if you don't mind. So you were bitten by a cat at what time, basically?
This was about 1.5 hours ago, yeah.
All right. And then you said it was a street cat or it was a home cat. Do you know the status of the cat?
I mean, it didn't have any tags on and it definitely looked like a street cat. It was very dirty and had some scratches on all over its body.
Yeah, so it was a dirty cat. And did you notice if there was any frothing from the mouth of the cat or anything touched your skin?
I mean, now that you mention it, when it was running towards me, I saw that there's some kind of a drool. I don't know if it's frothing, but it was definitely some kind of drool. It was not acting like a normal cat. It was very angry or aggressive, but yeah, I guess there was some saliva coming out.
Yeah, and you had some bleeding from the wound as well, not some, quite a lot.
Yes, from my leg, at first it was bleeding quite a lot. So I had to use some towels and handkerchiefs to just wipe that down. I did wash it just so I can clean it, but you know, it stopped after maybe 20 to 25 minutes.
Okay. What about your health status? Do you have any long-lasting diseases like blood pressure, hypertension, or just the same blood pressure, diabetes? Are you taking any medication that would drop your immunity?
Well, I am a type 2 diabetic. I take my medication on time. I don't have hypertension and I don't have any other conditions. That's the only one.
And do you have any allergies to medications, substances?
No.
Perfect.
Not allergic.
Perfect. One more question. Do you know if you got your tetanus vaccine within the past 10 years?
Maybe when I was a child, but I've not had something that sounds like tetanus anytime recently.
Okay. I'm going to proceed with examining your wound, if you don't mind. Can you show me the wound?
Okay. The patient shows you, and you conduct a physical exam on this leg, and that's what you see.
So I see a puncture wound in the leg. I want to check if there is active bleeding and if there is surrounding erythema, induration, or edema. I want also to check the neurovascular status and the mobility if the patient is able to move.
So neurovascular, sorry, stop please. Neurovascular distal pulses are good. He's able to move and feel. He's able to bear weight currently. However, you mentioned edema. There's a little bit of soft tissue edema. And what else did you ask?
Is there any foreign body in the wound? Can I see any foreign body?
Not that you can see.
Okay.
You mentioned the puncture, and what you see is what exactly is there. No visible foreign body.
Perfect. Okay. I'm going to proceed with managing the patient's wound. So I'll start first by ordering painkiller because obviously the patient is in much pain. He's not allergic to any medication, so I'll start by giving 1 gram of paracetamol.
Okay.
Meanwhile, I'll irrigate the wound and I'll examine closely if there's any dirts or any foreign bodies. And then we'll also discuss with the patient that he needs to get the tetanus and the rabies vaccine with the immunoglobulin. Since the patient is not, or he was not vaccinated for the past 10 years, I'm going to proceed with giving a tetanus shot. It will be in the muscle. This is what I'm going to explain to the patient. It's 1 shot in the muscle. That's for the tetanus. And then for the rabies immunoglobulin and the vaccination, I'll handle the patient a vaccination schedule, and I'll explain to him that it will be also given in the muscle, and it will be on this order. First shot will be today, and then the second shot after 3 days, and then the third one after 1 week, which is on the 7th day, and then the fourth on 14th day, and then the last is 28th. That will be arranged with the public health in an outpatient setting. The immunoglobulin will be given irrigation into the wound at a unit of 20 unit per kg, and the remaining will be given in an opposite limb.
All right. So the patient understands the instructions you've given him, but he's very hesitant about taking rabies. So Dr. Tasneem, why do I need the rabies vaccine? How are you so sure that this cat has rabies? I don't think that this 5 doses, it sounds pretty excessive. Tetanus, okay, let's get the tetanus now. Can I just go after that? Isn't that enough?
So your wound is a deep wound. It's punctured wound. And the cat, we don't know the status of the cat, but obviously it looked dirty cat and it wasn't a provoked bite. So this is a high risk wound that can be infected with rabies. And rabies is a very fatal disease. And so we have to prevent it. We have to play it safe, give you the immunoglobulin along with the vaccination. Rather than sending you home with only tetanus and then get the risk of getting the wound infected.
Okay, doctor, let's do this. Are there any other medications I need to go home with?
Now, we're going to discharge you on pain medication along with an antibiotic because, again, as we said, this wound can get infected. So at home, we'll give you Augmentin. You have to complete the course of 7 days. You'll get it twice a day for 7 days. Okay? And then you, as we said, we will follow up with your primary healthcare physician. But I need you to come sooner to the ED if you found that the wound is more swollen, actively discharging, urine discharge despite using the antibiotic, if there is any change in the sensation or the mobility of the limb.
All right.
All clear?
Sure. Thank you very much.
Thank you.
This was a case of a patient presenting with a cat bite injury to the emergency department. During the course of the oral case, the examinee should address stability and perform triage with a fresh set of vital signs. A focused history should be performed that should account for patient allergy, medication, and any known past medical or surgical history. It is important to examine and establish a contamination risk for this patient. A history of unprovoked attack with an animal who was seemingly aggressive establishes concern for rabies contamination. Make sure to address tetanus status and administer tetanus where necessary. The rabies vaccine and immunoglobulin has indications and a procedure for administration that should be followed and explained in these scenarios. The case should end with appropriate disposition and information about red flags and when to return to the emergency department.